To truly understand urinary incontinence, we must first appreciate the normal functioning of the lower urinary tract, which involves both the storage and the voiding of urine. The bladder acts as a reservoir, while the urethra functions as a sphincter. The bladder wall is composed of three interwoven layers of smooth muscle known as the detrusor muscle, along with mucosal, submucosal, and serosal layers. Both the bladder and urethra contain collagen-rich connective tissue, the proportion of which varies depending on the specific region and the sex of the dog, influencing the structural properties of the lower urinary tract. The urethra itself has an inner layer of smooth muscle, called the internal urethral sphincter, and an outer layer of striated muscle, the external urethral sphincter. In female dogs, the bladder neck is further supported by a smooth muscle sphincter that encircles the upper part of the urethra and gradually merges with the striated muscle near the vagina. Interestingly, this smooth muscle sphincter is less developed in male dogs, being primarily located in the prostatic and upper part of the membranous urethra. However, male dogs have a thicker circular layer of smooth muscle at the bladder neck. The external striated muscle in the membranous urethra constitutes a significant portion of the urethral wall, and its circular arrangement contributes to its sphincteric function. The entire urethral sphincter mechanism, responsible for maintaining continence, comprises these muscular components along with their supporting tissues and the neural pathways that control their activity. The process of urination involves two key phases: storage and voiding. During the storage phase, as the bladder fills, the pressure inside increases only minimally due to the bladder wall's ability to stretch and the active relaxation of the detrusor muscle. Low-level bladder distension sends signals via the pelvic nerve to a crucial area in the brainstem called the periaqueductal gray. This area acts as a central relay, communicating bladder information to higher brain centers and receiving signals that can either promote or inhibit urine storage and voiding. Excitatory signals from a specific region in the pons, known as the pontine urine storage center, travel down to the sacral spinal cord, where they stimulate motor neurons that innervate the external urethral sphincter via the pudendal nerve. This pudendal nerve stimulation causes the urethral sphincter to remain tightly closed, ensuring that the pressure within the urethra exceeds the bladder pressure, thus maintaining continence. Additionally, pelvic nerve signals stimulate sympathetic neurons of the hypogastric nerve, which act on the bladder outlet, and pudendal neurons, further supporting the contraction of the external urethral sphincter. The hypogastric nerve ultimately leads to relaxation of the detrusor muscle and contraction of the bladder trigone, contributing to continence.